Well, I hope everybody enjoyed their first week in our regulations class. It looked like everyone was doing a good job on the discussion board, so certainly keep up the good work on that. There were some interesting discussions out there. So this week we're going to look at ethics of trial design. So we've got a number of articles to take a look at this week. They're going to be centered around, first of all, the use of placebos in controlled trials. So as you read through these articles, you're going to discover that several of the authors argue the pro and cons of that. Some are in favor of it, some not so much in favor of it. And then eventually when you get to your discussion board, we'll be talking about that in a little more detail. We're also going to look at an article that discusses using women and minorities in clinical trials and some of the issues associated with that, why it's important, and why trial designers need to consider that as they design their trials. So I think you'll enjoy the articles that we have lined up for you this week, and I think you're probably going to learn a lot from them. Certainly if you have questions as you go along, post them on the discussion board, specifically in the area where everyone can see it in the questions to the instructor. So our learning objectives for the week, we're going to be discussing the ethical issues associated with using placebos in clinical trials. As you know, placebos just refer to no treatment, so it's going to be a dummy. The patient's not receiving the research article, the research drug, so they're basically not getting any treatment at all, and we're using that as a comparator against the trial treatment. We're also going to look at understanding the ethics of including women and minorities as research subjects in clinical trials, why it's important to do that, and why we need that data from those subjects in order to make our trial results as highly generalizable as possible. So anyway, we will be talking about that as the week goes on. As we start to look at the ethics of trial design, it's important to understand that for many people, the use of placebo in clinical trials is considered the gold standard for proving efficacy and safety results for a new drug. Essentially, you want to be, they argue that using those is the best way to determine how effective a new drug is and how safe it is within the clinical trial data. Also, we're going to look at the use of placebo when a safe and effective treatment already exists. There are some ethical issues related to that. Some think that it's not so ethical to do that. Others argue in favor of using placebo even when effective treatment already exists. In any clinical trial, there are going to be risks, and the trial designers are going to assess the risk-benefit before they start the trial. So every trial is going to have a balance between the risk to the patient and then the benefit to the society at large, or to that potential population of patients that could benefit from that treatment. And we'll talk about that a little bit. We're also going to be talking about the inclusion of women and minorities in clinical trials as study subjects and how important that is. And finally, for your discussion board question, what I want you to do is read through the articles and then think about the use of placebos in clinical trials. Are they ethical? Should they be allowed? Are there circumstances where they should not be allowed? Or are there circumstances where they should be allowed? So think about your past experience. Think about your own personal feelings about that. I would like for you to cite examples from the readings. You don't necessarily have to cite the articles in your posting. You can simply refer to the article by the last name of the author or authors if there's more than one. But at any rate, I think this will be a good question to think about, to ponder, these are issues that never go away. 50 years from now, we're still going to be talking about the ethics of using placebos in these trials. So it's never going to go away. So at any rate, have fun with it, and I'm looking forward to your responses on the discussion board.